Thank you, Ken and Karthikeyan, for this opportunity. So I'll try to cover the entire field of ophthalmic genetics in the next 10 minutes. Well, basically, there were a lot of things that was spoken in the last session, and therefore I'm sort of switching back to basics. So some of you who might have had advanced talk and you've been listening to it, this is very fundamental information. So we have about 10 to 100 trillion cells in the body, and majority of them carry a nucleus inside which you have the chromosomes, and then the chromosomes are made out of DNA. So therefore you can have disorders as far as genetics is concerned in the field of medicine where it can affect the chromosomes, which we call as chromosomal disorder, or it can affect the DNA, which we call as single gene disorder or complex disorders. Therefore, if you walk into a population anywhere in the world, you would find this typical pattern of genetic disorders. So as I mentioned, you'll have chromosomal disorders, single gene and complex disorders, and some of them are listed, which are much more commonly seen. There's one more disorder I've not listed here, which is another DNA-related disorder called as the mitochondrial disorder, which is usually maternally inherited. So in the field of ophthalmology, you would see more patients who have single gene disorders, as some of these you must have seen in your clinic, or in complex disorders, which could be glaucoma or other disorders. But if you see in a population, these two categories, including mitochondrial, are very rare. Okay, unless otherwise you're at a tertiary care center, you wouldn't see many patients. Whereas complex disorders are very common. So to this, if you add a variety of disorders like malignancy and neuropsychiatric disorders, which are non-ophthalmic, then that forms a major component of genetic disorders in any population. Now, ophthalmology has a lot of distinction, and many things have been discovered in ophthalmology which provide a lot of knowledge in the field of genetics, the entire field of genetics, and also medicine. So if you look at, for example, recently the gene therapy trials that is going on, which Dr. Natarajan showed you a video, is a sort of a trend-setting trial in the field of medicine, not only ophthalmology. For example, treating patients with Leber congenital amaurosis, and also very, very recently in choroideremia, just a few years ago. Now let's see that how you will classify genetic disorders. As I said, there are 4 categories. And then let's look how many chromosomes does human beings have, and that distinguishes us from the rest of the organisms in the globe. So we have 46 chromosomes, so therefore if you count them, so we have pair of each one of them, except for males in sex chromosome. But otherwise, each parent gives you 1 chromosome. So totally we have 23 pairs, which includes 1 pair of sex chromosome, which finally determines the gender of an individual. I'll quickly show you a list of signs, what you see in a patient. And just to make some of the postgraduate students to guess, as most of you would have guessed by now, so that's actually a Down syndrome sign that you would see. So these are typical faces that they have, and they have a single palmar crease, and that's the Brushfield spot, which you wouldn't see in an Asian patient. But if you look at the chromosome, all that you would see is that the chromosome 21, it's not a pair, but you have an additional chromosome. Therefore, if you count totally, there will be 47 chromosomes in these individuals. And elderly primate or elderly pregnant women beyond 35 years have a very high risk of having children with Down syndrome. Now, if you look at some of the other disorders like retinoblastoma, then that's a disorder where you have a segmental defect, not the whole chromosomal defect like Down syndrome, but it's a segmental defect where a particular segment which sort of resides the retinoblastoma gene is lost, and therefore a child is susceptible to get retinoblastoma. So therefore, how do you actually classify chromosomal disorders? So it can be in the autosomes, which are not sex chromosomes, or it can be in the sex chromosomes. So you could have a number defect, numerical, or you can have a structural defect like retinoblastoma. So that's the classification of chromosomal disorders, which are non-sex chromosome in nature. So we saw Down syndrome, we saw retinoblastoma. Now, sex chromosomal disorders, if you see, this is actually a patient with Klinefelter syndrome, who are excessively tall. Generally, they don't have any kind of ophthalmic condition for which they would come to an ophthalmic clinic. So if you count in them, they'll have 47 chromosomes, and there'll be additional sex chromosome, which will be XXY. Next is the another sex chromosomal disorders. At times, you might see such patients in ophthalmic clinic, and therefore they might have any woman who complains of color blindness. You have to suspect 45X, and they do have other conditions as listed here. So if you count the total number of chromosomes, they will have 45 chromosomes, and they lack one gender chromosome, and that's the reason they have the disorder. So in sex chromosomal, you have Klinefelter as well as Turner syndrome that we saw. Now we are moving on to the third category of single gene disorders. In a tertiary care center, you would see mostly such patients. So depending on where the gene is, it could be in the autosome or it can be in the sex chromosome. They could be dominant or recessive. Dominant is one copy is enough to produce the clinical signs and symptoms, whereas in recessive conditions you need 2 copies lost. So therefore, the normal gene will be suppressed by the dominant mutated gene, and therefore you could have the autosomal dominant disease. So this is, as most of you would have guessed, is a Marfan syndrome, and they could have subluxation of lens for which they could come to an ophthalmic clinic. Now, this is a typical cone rod dystrophy pedigree that we had come across, and they won't be typical, okay, as a textbook style, but you'll find that in each generation there will be an individual affected, and gender-wise it will be in both the genders because it is not in the sex chromosome, but it is in the autosome. These are the various other conditions that we have seen so far. The yellow ones I've never seen, but the green ones we have done genetic counseling. Let's move on to the autosomal recessive condition in the second category of single gene disorders, and then most commonly you see retinitis pigmentosa, and then this is in another family with oculocutaneous albinism, which is autosomal recessive, and they also have foveal hyperplasia. And consanguinity is a problem in my part of the world, in southern India, where it's not uncommon to see patients with consanguinity. So this is an uncle-niece marriage, and they had 5 children with, they had 5 children, or 4 had oculocutaneous albinism. So these are the other conditions of autosomal recessive inheritance, Usher, Stargardt, sickle cell, and so on. So the pedigree will be like this. So this is our own experience of a pedigree with retinitis pigmentosa. I came from a southern town in Tamil Nadu, from Tirunelveli, and you could see these double lines are all consanguinity. Okay, you could see that there are literally 5 consanguineous marriages, and it's quite impossible to stop them from getting married consanguinously for the simple reason that people don't marry them from outside because of the blinding disease. Now this is a pedigree which can be mistaken for an autosomal dominant inheritance, but this is a classical X-linked recessive inheritance where a person coming to you tells that their maternal uncle is affected and then their maternal grandfather is affected. So that's something that should indicate to you that it is X-linked recessive. In X chromosome, if you take, females have 2 chromosomes of X, whereas men have only 1, and therefore when there's a mutation in one of the chromosomes, women have a compensating X chromosome gene that will actually synthesize the product, and therefore they'll be a carrier and be quite symptom-wise normal. Whereas the male, since they have an alternative sex chromosome of Y, they always suffer from the disease. So these are some of the conditions of X-linked recessive that we have seen. And
one more minute, Professor Kumar.
Okay, I'm sort of coming to the end actually. So this is a typical mitochondrial disorder where mother transmits to all the children, or the female transmits to all the children. And this is a LHON case that we had done genetic counseling. And these are 2 other conditions of mitochondrial nature. The last category is actually the complex disorder, earlier called as multifactorial or polygenic. And then you have 4 different a combination of recipe for getting a complex disorder. So we inherit genetic risk and protective factors from our parents, but then when we interface that with the environmental risk and protective factor, then that determines whether you get the disease or not. For example, if I get a gene for bronchogenic carcinoma, and then from one of the parent, and then I keep smoking, then that's an environmental risk factor that triggers the onset of the disease pretty early, and therefore could be quite severe in nature. So these are some of the ophthalmic complex disorders that you would come across, that you would see in your clinic. There are many, many more in ophthalmology for you to do research in particular. So with that, I come to the last slide of the talk. In summary, in a population, you have 4 different types of genetic disorders. One is chromosomal, second one is the single gene, and the third one is the complex disorder, and fourth is mitochondrial. Thank you.